Hi, I'm Kit Carlson, and my presentation for Counseling 712 Family Therapy will focus on narrative therapy with neurodiverse families. So, my learning objectives for this presentation are first to define what do I mean when I say neurodiverse family. Then I'll explain some of the core assumptions of narrative therapy, and I'll discuss why narrative therapy might be a useful fit for neurodiverse families. We'll look at some of the literature and some of the evidence that suggests how and why narrative therapy might be effective. I'll also identify some specific aspects or some specific interventions of narrative therapy that can be applied or adapted for family work with neurodiverse families. We'll talk about aspects of narrative therapy like externalizing the problem, identifying unique outcomes, and reauthoring the family story. Then we'll take a look at a few cases in the literature. One case will look at an example of autistic meltdowns and associated family escalation and how narrative therapy might be applied in that scenario. And the other case focuses on ADHD and associated kind of problem stories and how families can reauthor their family stories. And then finally, again, looking at the literature, we'll talk about the possible strengths, the limitations, and ethical considerations of using narrative therapy with diverse family systems. This topic matters for a lot of reasons. It matters to me personally because I'm a person with ADHD and I have family members who are neurodiverse. Um, I know from my own personal experience this neurodiversity has typically been framed in a very deficit focused lens. And learning about narrative therapy, I realized there may be an opportunity to do some reframing of neurodiversity and make it a little bit more of an accurate representation within the family system. So there's a lot of stress that may come up in family systems that are neurodiverse. There's different communication needs. There's different possible sensory needs. Perhaps there's things going on in school, and there's certainly stigma and possibly challenging access to support services. And all of those stressors affect the entire system. From a narrative therapy perspective, I'm interested in stories that are arising around those stressors rather than identifying the neurodiversity as the problem, thinking about the associated stressors. Um, and I know that a lot of families that are experiencing this may feel challenged. They might feel like they're failing their children or failing the family in some way, feeling that they're always handling some kind of a crisis. And of course, the individuals who are diagnosed may feel that they're the problem. Interesting aside, a lot of families have multiple individuals within the family who are neurodiverse, which I think adds another layer. And sometimes family members may have a child diagnosed and then later recognize that they themselves are also neurodiverse. So um, in general, family therapy can help to shift that identifying neurodiversity and the individual as kind of the blame and help to create more of a shared understanding. And specifically, narrative therapy can be relevant in this work because it kind of helps the family understand what story is happening and how can that story um, affect everyone, and then how can we see what other stories are occurring, and how are those maybe better and more representative stories of our family. So for the purposes of this presentation, I am defining neurodiverse families as families that include one or more members with autism, ADHD, intellectual disability, other learning differences, or other neurodevelopmental differences. The umbrella of neurodiversity is very broad. The primary literature that I reviewed for this presentation included families with autism or ADHD. And most important point I want to make about neurodiverse families and defining neurodiverse families is that my intent is to be neuroaffirming. So, not to treat the neurodivergence as the problem, but to kind of have a balanced understanding of the strengths that neurodiverse families may have, as well as the unique challenges that neurodiverse families may have. So, a brief overview of narrative therapy. Narrative therapy, developed by Michael White and David Epstein, is based on the idea that people make meaning in their life through stories. They understand their relationship to other people, their relationship to the world, and even what they think could be possible for them through their stories. And a situation can arise where an individual or in a family system, a family can see a problem or problems as their dominant story. So, for example, a neurodiverse family may see that maybe they feel that they're always in chaos or there's always a crisis. And that's kind of the story of the family. And that's how they see their interactions with each other. That's how they see what's possible for them. And an important quote, I think, from Michael White was, "The person is not the problem is the problem." And so, a piece of narrative therapy is kind of understanding that problem is separate from the individuals, and and that will help the family see possibilities and see exceptions to the problem, and then be able to kind of craft something new. Some key terms and sort of steps in the process below. I should actually maybe have some of those in a little bit different sequence, but first, externalizing the problem, which I had just talked about. So in that case, one way I read that kind of was helpful to me, a person may say, for example, I'm a really high anxiety person. I'm an anxious person. And rather than labeling that person as anxious, the therapist would help by simple techniques like using language that extracts that label from the individual and makes it its own thing. It kind of objectifies that that label or the problem. So rather than saying I'm a high anxious person, the therapist might say, what does the anxiety cause, rather than you are the source of the anxiety, but the anxiety is its own thing. So that would be an example of externalizing the problem. Another way a therapist may help, but through using narrative therapy, would be identifying exceptions or unique outcomes, or sometimes I believe it's been referred to as sparkling moments. So when we have this kind of narrative about what the problem is and what the typical outcomes have been, helping the family identify times that that wasn't the case. And then reauthoring can happen when we can begin to put those sparkling moments together, both from past and current, and then ultimately from that, creating a roadmap to a preferred story. And it isn't that this is going to be some great new fairy tale, like, oh, everything's perfect now, but it's it's not the problem. This is a more realistic, real experience that the family is happening, not just weighed down with problems. And for these reasons, I think narrative therapy can be extremely useful for families, for neurodiverse families, because it takes away that label of, well, you're a person with autism, and because of that, you have these associated problems. It's not really a deficit, it's more of an opportunity to see strengths and values and a more positive story and future. So the published literature supports the idea that narrative therapy may fit very well within family systems work, partially because families share stories about each other. Um, and a lot of these stories may be problem centered. And then in many families, it's not the problem externally, it's the problem associated with an individual or individuals. And one reason that that could be stifling for families is it may hide other dynamics and it may hide potential, and a brighter possible story could be written if we understood those dynamics a little bit better. So in narrative family therapy, the therapist helps the family members describe how the current story is specifically affecting them, and then begin to evaluate and and change the emotional position of the family. Instead of everyone just focusing on the individual or individuals they've identified as the problem, the family can kind of look more externally at that problem rather than at the individual and create a new story. It certainly isn't going to remove all of the stress of the problem, but it reduces the focus on an individual as the problem, and it creates better opportunities for collaborating, working together, understanding the problem, and finding new ways to deal with the problem. So I think I've stated several of these points already, but to recap, I believe that narrative therapy can be particularly effective when working with neurodiverse families because narrative therapy is non blaming, and it is intentionally separating the individual from the problem. It specifically challenges deficit based labels so it can be very neuro affirming, and it creates room for everyone to understand how they see the problem affecting them and everyone to have an opportunity to say, here's a sparkling moment or here's an exception to that problem. And it's very strengths based. So things that a family typically may have seen as a challenge through narrative therapy, there might be opportunities to see the strengths and the opportunities and the uniqueness that this family has. And an important point I wanted to make before I got too much further into my presentation is that um, when we're talking about narrative therapy, externalizing the problem, um, is particularly important with neurodiverse families. The point isn't to externalize the identity or the diagnosis. We're not externalizing autism as the problem or ADHD as the problem or other neurodevelopmental issues as the problem. It's the um, it's the associated stressor. So maybe the stigma of the label, so the shame, or just being completely overwhelmed or misunderstood, or or the idea that perhaps you're a failure, or the pressures associated with it, the conflict that comes with it, the sensory overload, or all of the associated consequences that other members of the family may experience because of those stressors, not the label of being neurodivergent or specifically ADHD or autistic or whatever the label may be. And the peer-reviewed literature supports this way of thinking as well. So supports the idea that say when we're talking about neurodiverse individuals, and in this case, specifically the literature I reviewed was based on autism research. Um, One of the most effective ways to help an individual is to look at the entire family system, and the idea that effective support is family centered, not just individually centered. And narrative therapy can help address that. So the research is emerging on the effectiveness of narrative family therapy with neurodiverse families. And a very interesting study conducted by McKenzie et al. First iteration of this work was published in 2020, and then a follow-up study in 2022. They used a system called SAFE that embedded systemic family therapy, attachment narrative therapy, and multi-family therapy. And the narrative therapy component of this was focused on externalizing the problem and reframing the problem. And in this work that included 22 different families, participants described the interventions as helpful for reflecting. They had a greater sense of understanding. All family members felt less isolated. They felt more close, and they had better problem solving abilities. So the claims are still in the developing stage. So this is by no means saying that this is an effective treatment for all families, or all neurodiverse families, but there are some outcomes that suggest that narrative informed family work can be helpful, particularly in identifying patterns that would contribute to loneliness, conflict, stress, misunderstanding, and very importantly, dynamics that contribute to blaming the autistic child. There is also emerging research looking at narrative family therapy and in relation to ADHD. So Chan et al. Conducted a randomized controlled trial of a multiple family narrative therapy with 61 Chinese families raising children with ADHD. And their study found reductions in parents' psychological stress, in the child perceived parental rejection, and in paternal overprotection. The outcomes were mixed. So the study did not find significant effects for parental stress, guilt, shame, or the perceived parent child relationships. So there is some promising research, but it is context specific. It was interesting to me that a lot of the literature, or some of the literature I found, was not in the United States, did not occur in the United States, and that really got me thinking about the context and the cultural association with a diagnosis. And so that's certainly an area that a significant amount of research still needs to be worked on. I personally think that narrative therapy could be particularly useful in families, neurodiverse families with ADHD, because there are a lot of labels that are associated with ADHD. So careless, lazy, unmotivated, and these are very much labels that an ADHD individual will get, stuck with, and begin to identify themselves as. And alternatively, the parent may feel responsible or guilty or just simply overwhelmed and exhausted. And in all of these cases, narrative therapy can help the family separate that challenge and the label from the child's identity. And again, look for something different, look for exceptions, reauthor a story, and develop a preferred story. And also all of those pieces can help the family better understand the support needs that the family needs, and that the individuals, the neurodiverse individuals, may need, what kind of accommodations, and and then what kind of repair needs to happen for the family to really truly establish a preferred story. So the next aspect of this presentation will look at the core interventions that make up the foundation of narrative therapy. So we'll talk about them in the context of the family system. So specifically externalizing the problem, finding unique outcomes, and reauthoring the family story. So, a first intervention of narrative therapy that may be applied in a neurodiverse family system would be externalizing the problem. So, again, externalizing the problem means separating the problem from the individual. So, in the case of a neurodiverse family, perhaps we have a child who gets an autistic overwhelm, and they display that with anger or tantrum or something, some kind of significant outburst, and the family will identify that tantrum and the child's anger as the problem. So of course the child is the problem, the autism is the problem. A therapist may help to rethink that language and separate that language from the individual. So rather than this is a very angry child who gets, overwhelmed, it would be the overwhelm is taking over. And that point isn't to just say something in a nicer way, it's to take that burden off of the individual that's experiencing it and identify it externally from the person. And then it's a problem that the family can share and understand together. Maybe they can understand what's setting this off, setting the problem off, what has worked, when do we see it occurring. Another important aspect of this, when we're looking at the problem external to individuals, is that each member of the family can see how they're affected by it. And I believe that's an important aspect of repair. Then, once that problem has been externalized, the family can, I think, have more empathy for one another and begin to find new ways to handle the problem. One of my personal favorite interventions or aspects of narrative therapy that can be uh, included in a neurodiverse family system therapy would be finding unique outcomes. So, unique outcomes are times that don't fit the dominant problem story. So, I'll use an example from my family. I I have ADHD, as I've shared, and I have my own kind of self accommodated um, like lists and things I hang up on my mirror so I can, check my boxes and make sure that I'm, not forgetting anything and doing everything I'm supposed to do. And I was still very challenged getting my own children ready for school in the mornings. And I really saw that as, wow, my kids are chaos and I'm a terrible mother and I can't get my act together. And somehow I realized my own unique outcome. I thought, hey, I figured out how to get myself ready in the mornings. Maybe I can use those same tools that I'm doing, these simple tools, a post-it note, a little message to myself. I could apply those same simple accommodations to my children's routine and have a better outcome. I think that is an example of identifying when that dominant problem story isn't occurring, identifying that moment, understanding what changed, and then applying, especially appropriate for neurodiverse families, applying some accommodation. Like, hey, this support would be simple and it would change our story. And the family then is working as a team. We're saying, here's a problem that we're experiencing for whatever reason. This is our problem. And here's something that we've identified that doesn't always follow that problem pattern. Here's something that we can do to change and have a different story. So in this case, in a family therapy setting, the family therapist would help the family understand moments of competence, and then build from there, and really build the family's confidence and ability to work together, um, and kind of move away from the problem story. So once a family has externalized the problem and identified some of these exceptions and unique moments or sparkling moments, the family can begin to reauthor their story. So in this case, they can establish a story that isn't a fantasy, it's more of a reality. So rather than having the dominant problem paradigm kind of shape the entire story for the family, they can begin to build a more preferred and more accurate story about the family. And this includes the the strengths that the family has. So as the family understands the more accurate story, they can also identify the ways that maybe they've worked as a team, or maybe they've overcome significant challenges. This helps to build confidence in the family. It helps to unify the family, and I think have a more overall positive concept of their future possibilities. I think that this is especially, again, important in neurodiverse families, because a lot of times that neurodiversity is very deficit focused. And this process of narrative therapy can help the family see what else is true about them. Where do their strengths lie? And I think that's very exciting, and something that can leave the families feeling much more hopeful. So the next couple of slides, I'm going to apply these ideas to some family therapy literature. So the first example will focus on autistic meltdowns and associated family escalation and family kind of stressors that result from that. And the second will focus on ADHD and dominant problem stories in families with ADHD. And I'm using these to consider how a narrative therapist might approach this from like the clinical perspective. And that point isn't to say that we should always use narrative therapy in each of these contexts, but that these are real families that could possibly be more accurately understood through the narrative therapy lens. So my first study by Montauk et al. Describes the experience of parents who are handling autistic meltdowns. So their children are having meltdowns, and this study describes their experience of the meltdown as highly distressing, um, and really challenging to anticipate and manage. There's significant feelings of helplessness and, of course, stigma, and really feeling very judged by other people. And I think that this is an example that's useful for narrative therapy lens, because the problem isn't the autistic child. And this study shows us this. It shows us that there's broader, specific issues like fear and dread and helplessness. And of course, the stigma. What are people thinking? The judgment. And in this example, the narrative therapist would help to externalize that whole escalation of the meltdown process, and the dread that they experience around it. And they may ask questions like, when does the dread begin? And what does each member of the family do? And how are they responding? And how are they experiencing this? And tell me about the stigma that you are, experiencing with this, and how does that make the whole cycle worse? um, and then again, when when has the meltdown and the dread and all of these other pieces not felt so bad, and what was different about that? And this is an example of how we can take the focus off of the child and onto the pattern and all of the kind of facets of that pattern, rather than, again, the autistic individual. We can similarly apply this to ADHD. So, looking at a study by Ophir et al., that was a qualitative review that looked at a 2009 study that included three families who were facing an ADHD diagnosis. And in this study, the diagnosis became much more than a diagnosis. There was all kinds of additional factors of guilt and shame and prejudice, and a lot of kind of failure story wrapped up in that diagnosis. And in that case, a narrative therapist, again, would externalize this, would not identify the ADHD as the problem, but all of those other, associated consequences, the blame cycle, the negative beliefs around it, etc. And then again, help the family look for exceptions to that, stories of effort and ways that support could be improved. So it's not to say that ADHD isn't occurring, but keeping ADHD from becoming the whole identity of the individuals, and also the story that the family has been, holding and carrying as the problem. So I also wanted to bring up aspects of um, narrative therapy that may need to be adapted to be more inclusive for all participants. So some of the kind of traditional narrative therapy practices might not align with all neurotypes. So there are some aspects of traditional narrative therapy that might ask abstract questions, require extensive verbal reflection, um, and maybe even like quick processing, and that may not be accessible for all participants. And so, kind of thinking about how to make this neuroaffirming, that core components of neurotive therapy can stay, but the therapist can consider the various unique needs of the family members. So maybe it's a sensory need, maybe it is um, maybe it's that we don't ask questions verbally. Maybe there's more like drawing or writing, or providing more time to simply answer the questions. Thinking about, the ways questions are framed and asked, and then being really careful about the language that's used to ensure that it's not shaming language, and that everyone is comfortable. And I used an earlier example of some therapists will not necessarily label the problem literally, like the anxiety. They might, I heard someone refer to a behavior as Gollum. I actually have heard that in several different applications. And so labeling that in a way that's preferred for the family. And we'll talk about some specific adaptations that may be appropriate for some families that that narrative therapy could be useful for. So this table is kind of my attempt to consider a standard narrative therapy practice and a practice that may be more neuroaffirming. So just kind of adapting that to be more in alignment with the ways that are more inclusive and supportive of more neurotypes. So one example might be the way a question is framed. So a standard narrative therapy question might be abstract, like, what meaning does this story hold for you? And a version of that question that could be more accessible might be, what name do you give the problem? Or when does this show up? And this table also shows us that communication might look different. And, this is actually true for many people, not necessarily someone that has just been diagnosed as neurodiverse. And also, even the time of day can influence my ability to communicate. Am I hungry? Am I thirsty? Am I angry? Whatever, all of these things for everybody. So thinking about communication for everyone, I think, is helpful. So we can maybe even think of this as sort of a universal design aspect or adaptations. So again, those types of communication styles might include things like drawing or writing or mapping. Silence can be very powerful, giving people more time to process. Moving. I'm a person myself that I like to move around, and it helps me think. There are lots of ways we can think about that communication side that move beyond a typical narrative practice. I also wanted to mention eye contact. So Trevisan specifically reports on eye contact as an important point for some autistic people that may experience eye contact as uncomfortable or distracting, exhausting, or just generally overwhelming. So especially because we often think that people are paying attention to us when they're looking at us, that may not be the case. I actually personally struggle with looking at the person that I'm talking to, and yet we have assigned so much importance to this, like, oh, they're not telling the truth if they're not looking me in the eye, or they're not listening to me, all of these things. So people can be very engaged, but still need to look away, pause, think, process. True for everyone, and possibly more true for neurodiverse families. And I think some of these adaptations are intended to just be kind of a neuroaffirming. And I just wanted to make a few points about cultural and ethical considerations when applying narrative therapy with neurodiverse families. So, first of all, the therapist shouldn't be thinking about this as kind of a cure focused approach. So, we're not interested in curing a neurodiverse person. Um, and certainly being very mindful about ableist language and efforts. And the goal is not to make a neurodiverse person appear or become neurotypical. I think important aspect would be that the therapist is mindful of the neurodivergent person's voice, and that their agency is not taken away, especially when we're talking about children or teenagers, and just kind of being thinking about whose voice is centered in the process. I also think thinking about things like race, class, gender, disability, socioeconomic background, cultural influences, access to support services, all should be considered as part of this whole process. Another thing I think is important is that, again, the idea is to externalize the problem, not identify an individual as the problem. Um, and also understand the stress that caregivers may be experiencing in neurodiverse families, and the additional supports that caregivers may need to have a good positive outcomes, and that this is not meant to necessarily be the support, but narrative therapy is not intended to be the support necessarily, but to identify supports that could be effective. So they may definitely still need additional accommodations, medication, other psychoeducation, other services. Narrative therapy will complement that. It's a package, and it certainly doesn't replace all other aspects of care. So I tried to approach kind of wrapping up my presentation in a way similar to how I approached my analyses of the other peer-reviewed literature that we've looked at over the course of the semester, by considering strengths of the approach and possible limitations of the approach. So in this idea, thinking about narrative therapy or adapting narrative therapy for neurodiverse family systems, the evidence suggests, the published literature suggests, that there are some real potential strengths. So some strengths are that the model is non-blaming, it's identity sensitive. I believe it potentially fits very well with neuro-affirming practice, because it does not require that therapist to treat a neurodivergent identity as the problem. In fact, it intentionally specifically doesn't do that. I think it can also help families reframe shame and sort of those deficit focused stories. And I believe that really, really, really matters, especially to the individual with the neurodivergent identity, or individuals that may have heard this message as a broken record. And that's what the literature is showing us too, particularly about ADHD children, or children with ADHD. And also that, the parents aren't failures, that they are, in a challenging family dynamic, and they need to understand what their problems are so they can work as a team to have a better story. There is other evidence in the literature. So the ADHD literature looks at multiple family narrative therapy trials, the one that I mentioned from Montauk. Autism literature that was the autism literature and the SAFE family intervention, which looked at attachment narrative therapy and family therapy techniques. But that direct research base is still evolving. The findings look promising, but there's not a lot of breadth, and they seem to be also kind of culturally influenced. And there certainly needs to be some adaptations to traditional standard narrative therapy for neurodivergent populations. So maybe there's communication styles or sensory needs or processing differences. And again, as I said, those supports aren't replaced by narrative therapy. So I think that narrative therapy is promising. The literature suggests that narrative therapy for neurodiverse families is promising, and definitely compatible, but it needs to be used thoughtfully and as in complement with other needed supports. So in wrapping up, some of my key takeaways from preparing this research project and presentation would be that narrative therapy helps families isolate the problem and separate it from the individual. And another takeaway would be that neurodiversity affirming care doesn't treat the neurodivergent identity as a problem. So just because we've externalized the problem, it doesn't mean that we can externalize ADHD as the problem or autism as the problem. It's those associated stressors. So things like the shame or overwhelm or misunderstanding, or in my case, losing things all the time, school pressure, whatever, sensory overload. Another takeaway is that the literature supports the importance of moving beyond just support for the neurodivergent individual, but for the whole family. All the family is affected by routines that need to change or be evolved, advocacy, stigma, communication styles, interrelationships, and that this literature is still emerging. So that's another takeaway, that this work is evolving, and that there's certainly work and adaptations to be done to make it the most effective. What I really like most of all about narrative therapy is that it helps the family identify sparkling moments and use those to craft a new story that more accurately reflects the family and help them see their strengths, feel proud of the work that they're doing and the challenges that they've overcome together. And I think that's maybe the most exciting aspect of using narrative therapy with neurodiverse families. So kind of like, how can we do this together? Here's our problems. Here's our strengths. What are unique ways that we can work together? And it's not perfect, and nobody's going to have a perfect story, but this helps us um, adapt and manage more effectively. And finally, these are the references I used in my presentation. And I know that the text may be very small, so I will also include this as a separate Word doc that you can use as needed for your own review. Thank you very much.